Hello, this is Robert Brill. I'm a doctoral candidate in health psychology, and this is my Fibromyalgia podcast series. Today I'd like to discuss living with fibromyalgia. Some of us are living with fibromyalgia symptoms that never seem to go away. We live with chronic pain, overwhelming fatigue, and a myriad of other symptoms that truly get in the way of living a normal life. Treatment today works for some of the people, some of the time, and a cure is a ways off. We're just not there yet. This is why in order for us to live a quasi-normal life, we have to learn to manage our illness. This includes the psychological aspect of chronic illness versus the Western medicine aspect of treatment. I'm not suggesting that Western medicine has failed us in any way. It really hasn't. There are brilliant minds like Dr. Daniel Claw out of University of Michigan and Dr. Sharon Ostelecki working around the clock efforting the fibromyalgia epidemic. I'm simply suggesting that for some people, other alternatives are equally effective. Essentially, there's a percentage of those of us with fibro who don't respond to traditional drug therapies and even non-traditional therapies like massage, chiropractic, homeopathic, acupuncture, even yoga and tai chi. So what do the rest of us do when all of these things fail to provide us with results? Well, the topics I would like to emphasize here are acceptance, education, coping, and attitude. And I would like to add nutrition and fitness to this wellness plan as well. However, I won't go into those in depth today. I also like to use the word wellness a lot to describe the many number of different stages you will go through as you begin to reverse your fibromyalgia. Acceptance is the number one most important thing you can do to start down the path to wellness, regardless of what you suffer from. Whether it's fibromyalgia, multiple sclerosis, cancer, depression, or even if you have to learn to live without the use of your arms or legs. At some point you have to accept your situation. And I'm not just talking about agreeing that you have an illness, or accepting that you will have to make changes in the way you live your life in order to move on. I'm talking about accepting your situation in full. This is not an easy action to take. Who you are today has everything to do with who you will be tomorrow. But your attitude about the situation you find yourself in will mean the difference between illness and wellness. You have to accept that you have an illness. You have to accept that the very nature of your illness will force changes in your life. You have to accept that you may have limitations. You have to accept that you'll be in pain, often, and that some days will be better than others. And in the grand scheme of things, it may get downright ugly at times. While all of these shortcomings matter, they're also the catalyst for greater disability for many people who suffer from an illness or an injury that takes something away from them. You have to accept changes that will be required. And finally, you have to accept a degree of loss. Next, I'd like to discuss education, or education and advocacy as I like to approach the topic. When you first begin to develop symptoms, or when you receive a diagnosis from your physician that you have fibromyalgia, for example, most of you will likely go home and launch a desperate search on the web about anything and everything that can help explain your illness, and to provide some insights as to how to move forward from there, because not knowing is far worse than knowing the whole story. The problems with internet searches is that there's a lot of poorly constructed websites out there with invalid information that may lead you astray, and lengthen the time it takes to educate yourself and to accept your illness. And it further complicates your understanding of the illness. So accurate information becomes critical. There are a number of reputable sites that exist, like the Centers for Disease Control, the National Institute for Health, or the American College of Rheumatology. But there are also a number of sites that focus extensively on fibromyalgia and provide a wealth of knowledge, like Dr. Sharon Ostelecki's organization called HOPE, or Help Our Pain and Exhaustion, at www.hffcf.org, or my website, www.fibrobulletin.wordpress.com. The trick here is to find as much information as possible as quickly as possible, because the pursuit of knowledge will guide you to your wellness much faster. It's suggested that the average person takes 3 years to just get a diagnosis for fibro. 10 years ago, it took 5 to 7 years to get a diagnosis. That number is slowly decreasing, meaning that people are getting the right information about fibro much sooner than ever before, shortening the time it takes to learn to manage their illness. Education really is the key. It's the fundamental ingredient to living a better life, and it's no different with disease. Fibro Bulletin and HOPE provide a network of priceless information that's at the cusp of fibro research. Dr. Ostalecki partners with some of the most gifted individuals in the industry like Dr. Daniel Claw, who are paving the way for the rest of us. Once you've accepted your illness in full, and you've educated and armed yourself with a toolbox full of information, you're ready to learn to manage your illness and to use effective coping strategies. I'm not going to kid you and say that there's an easy path to wellness with fibro. For many, there's not. But when you fill your toolbox with the right kind of coping strategies, you'll be equipped to face the challenges when they do present. No matter how much or how long you suffer with symptoms like severe pain, debilitating fatigue, you never really get used to it. It takes a number of things to effectively deal with chronic illness some days. When you make your way through your wellness program, as I like to call it, you'll likely face some trial and error therapies, some that work and some that don't. I've always kept a wellness journal, and I suggest you do the same, where I document what's happening in my life with my illness, the medications I'm taking, which ones work, what side effects I've experienced, my diet, my symptoms, my exercise routine, cycles, or anything illness related I document. With this kind of knowledge, you'll begin to fill your toolbox with effective coping strategies. You document what works, and you build strategies from there. You network with